Okay, we're going to do the Decubitus images for the air contrast very minima. We repositioned our camera so that you can see around the x-ray tube. So first I'm going to start with the left lateral decubitus. I'm going to prop the patient up on the positioning sponges, so lift your hips up, okay, come down, and then lift up your upper body. And what this does, it builds the patient up from the table so that we do not cut off the edge, bottom edge of the colon off our finished image. Now we're going to put our image receptor in the cassette holder, palpate the crest, and the center of our image receptor will be at the level of the crest. Okay, and then put the image receptor right up against the patient's abdomen. And then your x-ray tube will be a horizontal x-ray beam. Okay, and I'm just going to check my distance to make sure I am at 48. Okay. Your line is going to be mid-sagittal, and then this line is going to come across right at the crest. So you want to be able to see a little bit of light on your IR so that you can place your marker. I'm going to put the right marker since the right side is on the upside. Okay, so this would be our image for the left lateral decubitus. Again, you'll ask your patient to take in a breath, blow your breath out, and hold it out, and take your exposure at that time. Alright, now we're going to do the right lateral decubitus, so the patient's going to turn to the right side. You'll have to reposition the sponges. Okay, and again, put your image receptor in the cassette holder, and then slide it so that it's right up against the patient. Palpate for the crest. That's going to be midline with the IR. Now, since his left side is on the upside, I'm going to put the left marker up, indicating that is his left side that is up. Alright, then double check your central ray. You want the central ray at the crest, and then cutting right across at the mid-sagittal. So you always want to check that mid-sagittal line on the patient, because if it's too high or too low, oftentimes you're going to be cutting something one side off. Okay, so then you can collimate down to the 14 by 17 size. Alright, next I'm going to do the cross table lateral for the rectum, and the patient is going to be prone. So this is the ventral decubitus. So go ahead and roll down to your stomach. Now you don't have to keep the sponges underneath the patient for the rectal image. You can use a 24 by 30 image receptor. Okay, and you're going to put this at the level of the ASIS. So if you want to go palpate, actually if you want to palpate the greater trochanter, you know that's the level of the pubic symphysis. So if you go higher from that, you're going to be at the level of the ASIS. So if you go about 3 to 4 inches above that, you'll be centered right at the mid-rectal area. Collimate down, because we are using the smaller image receptor, and we're going to be mid-coronal. Now, because this is the left side touching, or I take it back, this is the right side touching. Put your right marker on there indicating the side that is touching. Okay, and then this would be our final decubitus image.